So the biggest mistake I made early when it came to history taking was I tried to take too many things at once and really didn't know what exactly I was looking at. So history taking can be divided easily into a medical student template which you usually will have to follow for your exams, and then there are different histories to every format, and not all of them are wrong. Most of the time, all of them are right. For an example, what I can say is you have your general history taking format which you follow as a medical student, and that starts with demographic factors. So, demographic factors stating the presenting complaint, asking about the complaint, and the questions relating to the diagnosis, and then you move on towards past medical history, surgical history, drug history, allergic history, social history, and so on. Right. So this is just your basic, your template. So telling, and in addition to this normal template, what you have to keep in mind is that there is also, for an example, a trauma scenario. So like let's say you take a patient coming acutely after injury and you're handling this patient, trying to get some details out of him, and at that scenario you might want to follow a different format which is at mixed, something like age, time, mechanism of injury, the injury, then the signs and symptoms, treatment. So those things you can ask. Then if there's some kind of a chronic presentation, then you can ask for something like Socrates, site onset character, radiation, associated symptoms, timing, exacerbations, or aggravating factors, severity. So you can use the analog, something like that. So now, from this itself, you can understand that there are like three patterns so far. But in addition to that, you can also have something like a critical thinking. Like for an example, when you go to someone, you can't naturally start a conversation with that person based on some list. You can't just go around and just start ticking things up. So you might want to have an idea of this critical thinking concept, which means when you go, you ask what happened, when did it happen, how did it happen, where did it happen, why. So this is some of the few ways you can start a conversation. And until now, all of these methods of actually taking history are pretty good. You just have to formulate them much better when it comes to a specific case. So all of them are correct. Sometimes I always felt like I was doing the wrong thing, and I felt like I was taking a wrong history because some people told me to take like this, some people told me to take like that, but in the end, it's literally a mix of everything. So this is four methods, and another way, even let's say you're taking lump history, something like that. So in there, according to surgical, like lump history taking, you usually start like when did you notice it, how did you notice it, what is the progression over time, does it ever disappear, are there multiple. So those kind of things are, like what I'm trying to say is there's not just one specific way, and it's okay to have that confusion initially because there are many ways, and later on as you go along you understand where and where you can use these things, and hopefully you get better at applying them. And there's a lot of overlap, and there's no need to really right, be fighting within yourself. So that's history taking. Literally, I think I covered about five different types pretty quickly, so we'll see more.